Good morning, everybody. Stephen Fouts, Missouri Division of Tourism. Hope everybody's had a good weekend, and Monday is off to a good start. Just want to give you a quick overview of today's call. This is particular to the tourism and hospitality industry. As you're all aware, our industry has been one of, if not the single hardest hit industries by the COVID-19 pandemic. And so wanted to give you all some updates and some information and resources that you can use either at your business or take back to your communities to share with business leaders and stakeholders there. So each individual speaker will kind of introduce themselves, but I'll give you a general rundown of how today is going to proceed. We'll first hear from Mark Stumbaugh, who's going to discuss industry security communications. Then we'll hear from Brittany Hendren, who's going to discuss pool and lodging industry guidance and best practices. Then Aaron Winslow is going to talk about testing and how to run your business safely. After that is Daniel Stark, who's going to discuss on-site health and safety consultation. Then we'll close the call out with Dawn Brooks, who's going to discuss the state's PPE marketplace. After that, we'll have time for Q&A, but again, to Ashton's point, if you have a question, feel free to type it in the chat. It will try to be answered at the appropriate time. With that, I'll turn it over to Mr. Stumbaugh.
Thanks, Stephen. Good morning, everybody. Appreciate everybody's time and the team members here to try to arm you with some additional information. Just a quick background kind of on my role. Have been in economic development for about 15 years or so, but much like a lot of us have only recently, become the expert on testing PPE and various other things that we never thought we would be, of course, and I use expert as loosely as possible. But appreciate the rest of the team members that are on with us today. My focus is really to talk to you just about what we're doing in terms of industry outreach. Stephen mentioned, the travel, tourism, and hospitality industry is a key economic driver for the state of Missouri. Our teams in the field are trying to do outreach one-on-one to help build relationships and make sure you all as employers have the resources that you need. So I'm just going to kind of lay the groundwork or framework here. Ashton, if you can go to the next slide. The pillars of the recovery plan have been out there for a while. I hope everybody has seen and heard from Governor Parson how he's building the economic recovery. Things like the data monitoring and predictive capabilities are critical in driving our decisions going forward. We're going to talk a little bit more about PPE today, that protective equipment, and I know that's something that our regions are handling in different capacities and has to flow from everything in the healthcare-oriented sector to our individual small and large businesses that may have new needs for personal protective equipment. And then testing, this expanding the testing capacity and volume and why that's so critical. And so the note at the bottom there too, just we recognize that different communities, different regions of the state are in different places in their battle against this virus. And so this is designed to be flexible, and to the extent we can plug in and help you with any of your needs, we're absolutely here to do so. So we'll jump into the next slide as well, which is, how we're looking at it. We need to have a better lens into and through testing of the prevalence of the virus. And so we're looking at it from the standpoint of how do you all as employers have consistency of operations going forward, both now in these summer months, but when we look forward into the flu season, into the fall and into the winter, how do we also allow our employees to have some level of expectation and assurances of the type of workplace that they're entering and that they're going to be safe while they work on the job. So Ashton, go ahead and jump forward. What you've seen publicly in terms of the testing strategy specifically in some of the governor's press releases is he talks specifically about a goal of 7,500 tests per day. I want to give you the idea for where that is coming from primarily, though, because what we're hoping to do is activate you all as an industry and you all as employers to continue to do additional employee testing and really drive this number even further. So again, we just have better data we have a better understanding of how prevalent this virus is. So the 7,500 goal is really made up of a couple of larger buckets, and that would be those long-term care or congregate care facilities where we've had some of those stronger outbreaks. It's made up of more of our vulnerable populations, our mental health, our corrections, the facilities that the state owns and operates, primarily, and then also the critical component of community sampling. And we've done a handful of those events throughout the state. Hopefully some of you have already participated. And I know that team is working with county health departments across the board to make sure that we can continue to have open testing for anybody in the community that wants it. So that's kind of the backbone for the 7,500. But again, what we're hoping to do is provide the resources, the matchmaking necessary, and when opportunities present themselves to address specific industry groups or do additional value-added assistance, please let us know. And that's really where we want to be to continue to support you guys. So next slide, please, Ashton. I think we'll continue to support the collective efforts, as I said, on the call with us today are a variety of resource partners that help us better understand it and that help you better understand it. We get as much as anybody now that there's a ton of information being thrown at all of you. So we're trying our best to be concise, boil that down where it's applicable for everybody, and be available to answer those questions, those follow-up things looking forward. So as you're thinking through this, my contact information is at the end of the presentation as well, and our team of project managers and resources in the field. As you're thinking through these things today, if you think of resources that you need, if you think of questions that you still have that you need clarification on, please don't hesitate to reach out to myself or our team so we can help. With that, I think I'm going to turn it over to Brittany now to talk a little bit about the lodging and pool establishments. So.
Yeah, thank you. I'm Brittany Hendren with the lodging program for the state of Missouri. Ashton, you can go ahead and go to the next slide. So we're going to talk a little bit about the cleaning of lodging establishments and the maintenance for pools during the social distancing for the COVID-19 pandemic. So obviously you've heard a lot about disinfecting surfaces frequently with EPA approved disinfectants. There is a list of those approved disinfectants on the EPA webpage that you can get, and then allowing those disinfectants for allowing them for their proper time to air dry. That is a really important step to allow them to air dry. It allows the disinfectant to work properly. And we encourage housekeeping staff not to shake laundry and to launder all any kind of laundry according to manufacturer's directions. Just not shaking it allows anything to not be drawn out into the air, anything like that. So we just want to minimize the risk of the virus being spread. And also wearing disposable gloves whenever handling dirty laundry or cleaning rooms and wiping down those frequently used surfaces. Thanks, Ashton. So social distancing, we want to keep that 6 feet distance in lobby areas. Breakfast areas, tables should be placed or removed so that people will be seated at least 6 feet apart. And that would apply to business areas and conference rooms also. Next slide, Ashton. So kind of getting down into the nitty gritty here. So what should you do if you have a guest that has COVID-19 or you've been notified that a guest that stayed at your facility had COVID-19? So we've had some people reach out to us, like we have a guest staying here. Maybe they don't want to go home and they're in their isolation period. So some recommendations we have for that: do not clean the room during this time. The guest who's staying there should remain in the room at all times. If they need new bedding, pillows, anything like that, that can be left at the door and the guest can acquire it after hotel staff has left. And then have the guest immediately remove anything that's got blood, stool, or bodily fluids on them and store them in a trash bag that can be given to them before they enter the room. And then I would just have those like to stay, oh, sorry, go go right back. Sorry about that, Ashton. And then anything that's like obviously heavily soiled, I would consider discarding just for the purpose of making sure that everything stays clean. And now we can move on, Ashton. So we're also recommending that if you know the guest has COVID-19 to leave the room closed for a minimum of 24 hours. Meaning that once they leave the room, do not enter the room, do not take clothing out, do not take any type of laundry out. Ideally, it would be nice to have it sit there for 2 to 3 days if you have the space, but a minimum of 24 hours to allow that virus to just kind of dissipate in the area. And then make sure that your housekeepers are wiping down thoroughly all of the hard surfaces with that approved disinfectant and allowing it to air dry. And making sure that you're washing all the bedding, and that would include the bedspread, pillow shams, bed scarves that are in the room while it was occupied. All right, so moving on to the pool operations. So just making sure that you're checking your pool chemistry more frequently to maintain your adequate chemistry levels. Removing loungers or chairs to maintain that 6 feet social distancing. Making sure that guests maintain 6 feet social distancing in and out of the water. We don't think that it's spread in the water, but again, there's a lot we don't know about the virus. So we just want to make sure that we're maintaining that at all times. And then allowing some other suggestions, maybe allowing a certain number of guests at a time in the pool, or having guests make reservations for the pool to maintain lower numbers. Having guests bring their own towels from their room as opposed to picking them up in a generalized pool area, and cleaning and sanitizing the pool area, bathroom, and handrails in the pool area between use. So if you do the reservation suggestion, you would have someone go in between each reservation and clean and sanitize those areas, wipe them down, and make sure that they're good and clean before the next reservation would come in. So just a quick note here at the end, the governor has granted an extension for lodging inspections this year. So what does that mean for any lodging establishments? So the local public health agents have been given an extension they do not have to complete their initial inspections for lodging until October 1st of 2020. So if you don't see a local LPHA in your lodging establishment right away, don't be alarmed. They should get there. But again, they don't have to have those initials completed until October 1st of 2020. And what does that mean for your lodging license? So with this extension, the governor also granted that lodging licenses that normally expire on September 30th of every year will not expire until December 31st of 2020. So your lodging license has also been given an extension, so you don't have to worry about that being coming up and expiring in September. You've got that till the end of the year to get all that stuff in and get everything taken care of. Again, my information is at the end of the presentation, so if you come up with any questions or anything, feel free to send me an email or get in touch with Ashton, and we will get your questions answered as soon as possible. Thank you.
Thanks, Brittany. This is Aaron Winslow. I'm also with the Bureau of Environmental Health Services in the Department of Health. And, you know, my main job during routine times, I'm I guess you consider a state health inspector or environmental public health specialist. And our routine work is to interact. I have district staff that are scattered around the state. And on a routine basis, we're working with the city and county health inspectors to do these lodging inspections, as Brittany's talking about, restaurant inspections, communicable disease investigations, and so forth. So that's our routine work. Go ahead, next slide, please. So with the advent of COVID-19, our routine work and the county's routine work more or less stopped in this area, and it became a focus to work as everybody else has been with COVID-19. And it really has fallen to the city and county health inspectors to be the main ones out on the front lines to implement the COVID orders, and therefore our role then to help support them in giving guidance and technical assistance in the implementation of those orders. So we've been spending a tremendous amount of time doing that and communicating with the local public health agencies and doing that. And it became obvious, especially about a month ago, as the order switched from stay-at-home to the reopening order, that having prescriptive plans and guidance for all of the different possibilities that existed out there, especially in this sector, was just impossible. There was just a tremendous variety of different businesses, and instead of being able to have prescriptive plans across the board there, we really came to a process, and that process was really to allow the businesses, to allow all of you who know your businesses best, to work a plan back and present a plan to the local public health agencies of how you would best operate. And so that's a large part of what I want to do today is just Brittany's talked about some prescriptive guidance. I want to talk about kind of a broad framework of working within, then to develop plans from and move forward with that. And also a little bit about response as well toward the end. Next slide, please. So as I said, the LPHAs, the local public health agencies, are a huge part of this. There's obviously different guidance available from different state partners, private consultants, and so forth. But once you have a plan, especially if your plan doesn't fit within a prescriptive guidance, really encourage everyone to be a partner with your local public health agency and present them with the plan. It's really a good partnership going forward to do that. Here in a second, as I talk about risk, a few caveats here, obviously, that this is a constantly evolving situation, continuing to learn more about the virus, and that any level of personal risk does depend on personal responsibility and the health status of that individual as well. Next slide, please. All right, start with some kind of basics here, but I want to emphasize some of these points because some of our compliance checks we've done, it seems like sometimes this is forgotten, but again, COVID-19 is a respiratory viral disease, and the primary and most important mode of transmission is through that close person-to-person contact. Again, not saying that all of the other things need to continue to take place and take place very well in terms of hand washing and all of the surface disinfectant and so forth, but again, don't lose sight that this is primarily spread person to person through respiratory droplets. And again, when I'm talking about droplets, I think sometimes people get the picture that this is some huge glob of gunk that's coming out, and certainly there's a lot of risk from a huge glob of gunk, but as already been mentioned, this is an invisible enemy. These are respiratory droplets that are not visible to the naked eye. It doesn't take a sneeze or a cough to be expelling them. Talking, singing especially, laughing is very effective at passing these, if somebody is infected, at passing those out into the environment. And again, you don't have to be showing symptoms to be doing that. Infectious droplets can be spread by people who are pre-symptomatic or asymptomatic. Next slide, please. I want to do a quick refresher on symptoms as well, because these continue to expand as the list continues to be expanded by CDC. We started out, there were 3 or 4. Now, if you look at this list, it's a wide range of symptoms that, again, can mimic any ordinary, most any ordinary disease out there. So you need to continue to pay attention to the symptoms. And again, think about this, and especially if they're mild disease, how you're screening your employees for these things and or testing, which has already been mentioned, and I'll mention again. Next slide, please. So when we start thinking about a framework for transmission risk, I want to throw out, again, some general concepts, apply across the board really to any type of business. So again, to limit dose then, I want you to think time, space, people, place. Not a lot of conversation around dose, but dose really does matter. Dose is basically that amount of virus needed to establish an infection. Still unknown at this time exactly what that dose is for SARS-CoV-2, the virus that creates the disease known as COVID-19. But generally with most viral illnesses, the more dose the person is exposed to, generally a quicker progression of illness and more severe illness. So it is really important to limit that dose, again, to prevent more severe illness or illness at all, and to use a lot of layers of interventions to limit that dose. Next slide, please. So time is obviously critically important. General rule of thumb out there is that a person is a close contact if they've been in exposure zone for 15 minutes or more. So when you're thinking about that, then think about what that means in terms of if you potentially get exposed in 15 minutes, what happens if you're in close contact or in contact, 4 hours, 8 hours, especially if you repeat that day after day. So again, try to limit time in the exposure zone. Space or / distance, obviously very important. Key component of our plan moving forward is to keep people out of each other's breathing zone where, again, those droplets are being transmitted. Keep as much distance as possible. Next slide, please. So people, it's kind of obvious. It's person-to-person spread of disease. Limiting contact with people is key to limiting transmission. So crowded conditions, being around a lot of people, obviously increases those risks that you're going to, be in contact with somebody that's infectious, somebody that's a good spreader. Again, the old saying, be a sayer, not a sprayer. It's just somewhat true. I mean, different people do have different speaking patterns, volume of projections, more chance of being around someone like that, or more chance, unfortunately, of being around somebody that's being non-compliant, not being effective in maintaining social distances. Place is also very important. Well-ventilated open areas are better or less risky. So generally outdoors is less risky than indoors. Again, with the caveat that personal responsibility is being maintained. And if somebody, two people are face-to-face for a prolonged period, it doesn't matter if they're outdoors or indoors, they've got a huge risk of spreading the disease. But again, in general, the outdoors has the large ventilation, huge volumes of air to dilute, and more space to maneuver and stay away from people being non-compliant. Next slide, please. So again, and this is, again, kind of stating the obvious, but the most risk situations are obviously those prolonged close indoor exposures to multiple people. And again, as we look at where the spread is mainly occurring, it is within these close contact congregate settings. Least risk situations then are situations where you have, very little time, more open area, more limited people, or people that are known to already be part of your group, and they don't have much exposure. Next slide, please. So when you're looking at this again, and you're thinking about what might be your business and how you would interpret this and apply this to your business, give a couple of quick examples here. So one example, again, provided personal responsibility is taking place that would be generally low risk, would be a family or even a multi-family kind of group outing, canoeing and camping, especially if it's BYOC, bring your own canoe. So again, when you think through the time, space, people, place, with a little bit of personal responsibility, that can be done with very low risk. Brief time exposures, even if you stop at a store or something, you can maintain your social distancing. You got a well-ventilated area, generally low risk. More high-risk setting would be, for example, if you didn't bring your own canoe or were having your canoe hauled by a company and had congregate transportation going on. Again, when you think through the four factors there could be, half hour or greater of time, space. You could be in that confined setting in a van or a bus. You got a group of people that could have traveled in from all over, so you're exposed to multiple people. And again, kind of a potential, at least a poorly ventilated area in a van. So again, when you get into these type of situations, and that's where the plan needs to be developed to address those variables to lower that risk. And again, as we've all seen, social distancing, just putting a sign up saying, hey, stay apart, is very difficult to manage and control without administrative and engineered controls. Again, a COVID bouncer, gates, et cetera, to help manage the flow of people. Next slide, please. All right, so speaking of managing people, again, I think that is a very effective things to think about. So some of the steps you can take to protect your business and the public. Again, this is the staff shelter in place on the grounds is probably off the table for most people. Maybe a remote camp or something where you had interns or summer staff coming in, perhaps they could kind of shelter in place on the grounds and not have much contact with people. Another possibility would be cohorting staff and or the public. So you keep your staff cohorted in a group where they're only having close contact with each other. That way, if there is a case, it's not everybody, all the staff that are exposed that have to be isolated and quarantined, but only a select group of staff. Of course, employee screenings are always good, and there's a lot of that use going on. Again, the questionnaires, the temperature checks, and then another thing that falls along with that is collection of good contact information. So keeping really good records of what days staff work, who they were exposed to, what, if possible, what public were there. That way, if there is a case, that this information's known and there's, easy to trace back and know who was where when. Without that information, it may have to have some more broad exclusions to protect the public that might have been exposed. Of course, it's recommended by all the orders that if the social distancing can't be maintained, that face coverings or masks are worn. Again, they're not great as PPE for that person, but they are being shown to be highly effective at blocking those exhaled respiratory droplets. So again, and it shows good faith, across the board to implement all the controls that are out there. It's already been plugged once, I'll plug it again. Another really good part to have in your plan is that routine COVID testing. Again, with this wide range of symptoms and unknowns, really good to go ahead and get that in place and have that as part of your plan to be testing people on a regular basis to give you that step ahead in case you do have something come up. Next slide, please. All right, so what happens if you do get a case in a business? So again, it's a little different depending, again, the cases may be employees, guests or customers, or it might be a common source outbreak. In other words, a lot of cases come up, they're doing contact tracing, and all of the cases are saying, as they're being talked to, they're saying, yeah, I spent a week at Camp XX last week. So it plays out a little differently depending on how some of the cases come up. But again, the general steps that will be gone through here, you'll see step one is awareness, so they'll be reporting to public health. Then there'll be calls to the cases and lengthy questionnaires filled out to determine who was exposed, where and when, probably additional COVID testing recommended at that point, especially to identify any gaps or patterns that were missed, and then possibly an environmental site visit by the local county or city health inspector that I've been talking about, or one of our staff, to kind of take a look at the scene, at the facility, and see how operations are going. Next slide, please. And then lastly, there will be an implementation of controls. All that information will be gathered, discussed, and then usually the local health authority in charge of that location with our state support will determine, again, general recommendations would be isolation, that the person that was ill restricted from the business, potentially that others that were exposed, those close contacts, employees, could be quarantined till they were tested. There would be personal notifications, which would be calls to those people, letting them know of their exposure risk. Possibly public notifications. I think we've all seen some of those in the last few days, that, hey, there was a case at X business during this period, and to let the public know that they have that potential exposure risk by being there. Of course, immunization is not on the table right now, maybe on down the road, and then cleaning and disinfectant, and then as last resort and not a normal course would be closure of that establishment until controls can be reinstituted. So that's kind of a quick overview. Again, thanks for your time this morning. Next slide. Oh, so again, working together again, we have the common goals, I think, to protect public health and safety and keep businesses going and keep Missouri moving forward on the road to recovery. Next slide.
All right, thanks, Aaron, for your presentation. We're going to switch gears a little bit. My name is Daniel Stark. I'm with the Missouri On-Site Safety and Health Consultation Program. And basically what we do is we're invited in by small businesses throughout the state of Missouri and help them get in compliance with OSHA. And not only help them get in compliance with OSHA, but hopefully develop a good safety and health management system. Next slide, please. Basically with our program, and a lot of employers are interested in this, is they're interested in doing it like an OSHA type mock inspection. And the reason why we can provide a good OSHA type mock inspection is two main reasons. One is that we go to the same training as the OSHA compliance officers do up in Chicago. So we sit shoulder to shoulder with compliance officers and get trained in the same information they do, the same standards, the same letters of interpretation. The second reason we can provide a good OSHA type mock inspection is that we get copies of the OSHA citations that OSHA is writing, not only in St. Louis and Kansas City. So those two things coupled together, we can provide a good OSHA type mock inspection. With our program, there are no fines, penalties, or citations. OSHA enforcement does that. We don't do any of that. The program is free. It's 90% federally funded and 10% state funded. So each year I write a cooperative agreement with OSHA, and the program is funded 90% through federal OSHA, and the state of Missouri matches 10% of that. The program is also confidential. We don't tell anybody where we go, especially OSHA. OSHA recognizes that it's important that we delineate a line between enforcement and consultation, so the program is 100% confidential. The only obligation an employer has when they participate in the consultation program is they have to correct the serious hazards that we identify. And we give the employer a certain time frame to correct those particular hazards. And for some reason, if an employer refuses to correct a serious hazard, by law, we have to refer that employer back to OSHA enforcement. However, since we've been in existence since 1979, we have never had to do that. So next slide, please. Okay, how can consultation help out with COVID-19? Well, most of the time, we're able to do on-site consultation visits. We've had to change the way we operate those visits a little bit here recently because of COVID-19. But another nice alternative to the on-site portion of the visit is to conduct virtual visits. So if we have an employer that has a question regarding any type of issue regarding safety and health, a lot of times what we can do is conduct like FaceTime visits with them. They can email us photos or videos of particular situations, and then we can get right back with them and determine, if they're in compliance and things that we can recommend to help remedy the situation. Another important thing to remember and to think about regarding COVID-19 are the basic controls and the hierarchy of controls to control COVID-19. So we can help out with that. Specifically, what we want to always look for before we go straight to personal protective equipment is developing and looking at engineering controls or process changes. And that's kind of what the picture that's on your screen right now to the right there, that really illustrates kind of what I'm talking about. So at the first tier that's in the red there, we've got a situation where workers are working less than 6 feet on their left and right, and then across the table, across that conveyor, they're also less than 6 feet. So if we could basically remove the people that are across the table and expand that distance to 6 feet, we're going to be at a much lower risk for COVID-19. Another situation would be to implement engineering controls, such as introducing a partition between the two workers, or down at the bottom there, introducing a horizontal partition where you can add 2 extra workers back in where you had to remove them before. So these are just examples of of engineering controls, and these are things that we want to look at just instead of going straight to personal protective equipment. Now, with COVID-19, a lot of employers now are having to use personal protective equipment or certain types of respiratory protection that they didn't have to before. So one of the things the consultation program can help out with is getting the employers or getting you in compliance with OSHA's personal protective equipment standard, as well as OSHA's respiratory protection standard. So we can help out with in those two areas. Next slide. Next slide, please. All right, so if anybody needs more information regarding our program, feel free to go to labor.mode.gov/onsite, or feel free to give us a call at 573-522-SAFE. And that's all I have for my presentation. I'm going to hand it over to Don Brooks, who's going to talk about the personal protective equipment marketplace.
Hello, everybody. My name is Dawn Brooks. I'm the COO and Deputy Division Director of the Business and Community Solutions. Next slide, please. What I'm going to talk to you today is the Missouri PPE marketplace. PPE was incredibly foreign to me before COVID, and I'm sure to many of you it was something that was not of your daily business practice. Next slide, please. The state of Missouri was competing against not only other states, but truly the world when it was coming to the PPE supply and demand chain. And one of the reasons why I developed the PPE marketplace was to make sure that PPE stayed within Missouri's jurisdiction. We wanted to make sure that PPE was going to our hospitals, our businesses, our residents. It truly was just a way for us to make sure that we can continue business as usual, but in order to do that, we have to wear the PPE. The second part of this project actually focused on the nation's PPE supply chain, where we're going to be connecting raw suppliers to U.S. manufacturers making PPE. Missouri is really on the cutting edge of a lot of other states because we have many manufacturers that are beginning to retool and to make PPE as their business process will be changing. It's actually going to be where we're going to have American-made PPE, and it's grabbed the attention of the president and the vice president. Next, please. So who's allowed in the PPE marketplace? Well, we've completed phase 2, but truly the only people who are going to be allowed to buy are Missouri healthcare providers, businesses. We have many businesses that are going to the PPE marketplace. We've got everybody from, restaurants to hair suppliers to downstream providers, nursing homes as such. But the second phase of it, as I said, American-made PPE. We've got raw suppliers from all over the world, but we really want to focus, on manufacturing to the U.S. only. Next slide, please. Okay, so really I want to make sure that everybody understands that the Missouri PPE marketplace is not a place for you to submit an order. It is an area where we are going to have you guys log in. You can start at the Missouri Department of Economic Development homepage, the Missouri PPE Marketplace button. Next slide, please. Or you could be going to the PPEmarketplace.mo.gov is the other place where you can register. So first thing you're going to do before you register is you're going to see down there in the corner, you're going to see, what are you? Are you there to buy? Are you there to sell? Are you there to sell raw materials? So you need to put in, hey, I'm a business and I'm looking to purchase PPE supplies. Go back, please. I want to make sure, so this is going to be a pretty comprehensive registration process. There were several attacks on government PPE sites, and so we took a lot of effort to make sure that we were, registering people who truly were owning the email and so forth. So what we're going to do is we do have a registration process. Okay, next. This registration process will require you first to put in your email. That email will then be sent a registration link that you'll see here. If you do not get this in your inbox, please check your spam. I would say 95% of the problems that we're having are with cybersecurity on the user side, some sort of firewall or network security issue. But please check your spam folder if it doesn't go into your inbox. From there, you're going to go and you're going to you'll click on that link and you will register your information about your company, contact person, and so forth. You will then press submit. You will get another email. From there, you will create a password. Once you are done with that, you will go into the login page and you will put in your username, which is your email, and then your newly created password. Next. Okay, so what are we doing here? Each one of these is the PPE supply that the state is trying to understand collectively the PPE needs overall. We don't want to just stop at healthcare industries. We want to understand what are the needs of businesses, downstream providers, healthcare, hospital, everybody. So what we're asking for here is, do you have any PPE on hand? And if you do, and if you don't, or you're looking to purchase, how many do you want to purchase? And then, of course, the status of the supply. If you do have PPE, are you in critical or you're running out of it? Or, and we have the rules there. So you would press save, and then you would move into the supplier page. Next, please. So here's the list of available supplies from suppliers within the PPE marketplace. You can search by FDA approved, you can search by name, you can search by price. But what you would do is, if you were looking for, surgical masks, you'd put that in there and you'd roll over that eye-looking icon to get more information about the seller. Next, please. This is what that view would look like. You'd have the eye and it would show that it has face shields and that they want upfront payment terms and so forth. Now, we do caution people. PPE is, this is just something that's very foreign to purchase to a lot of people. So if you're working with a vendor who has a Gmail account, a Yahoo account, be very cautious of that, as well as if people are asking for upfront payment terms. So we have some helpful tips on the previous slide, and we also have a place that you can go to on a website that's actually was made to vet new PPE vendors. It's just there's been a lot of legitimate companies who've just gotten into this, that are, maybe they had a 3D printer and they're making face shields. They are legitimate. They are a newer company, but it is your responsibility to make sure that you are vetting who you are purchasing from. Next, please. Oh, I guess we're at the end here. But just for, final reiteration here is that this is just something, an informational purpose that the state of Missouri was trying to bridge that gap for people who are just not, or businesses that are not used to purchasing PPE. And we're trying to bridge that gap where suppliers who are selling it can get to the buyers who now need it. And that's all I have.
Yeah, I think, Ashton, I think maybe if there's one more slide, does it have all the speakers' contact info at the end, maybe? There you go. And then there was a question about homemade masks being included in the PPE offers.
If that is about the homemade mask being allowed in the PPE marketplace. If people are making homemade masks and they, do meet, I guess, some of the PPE requirements or the PPE item, I don't see why people who are, sole proprietors wouldn't be allowed to go in there and do that. So hopefully that answers your question.
There was also a comment that there are resources at the American Hotel and Lodging Association for Stay Safe that describes good cleaning, PPE, and social distancing information. Yeah, thank you all very much for your time and participation today. We hope you found the information useful and valuable. Again, there's contact information on this last slide here. Leave it up for another couple seconds so you can write down anybody's email that you feel like you might need to get in touch with. Hope everybody is staying safe. We're looking forward to getting the travel and tourism industry in Missouri back up and open safely and as appropriate. So that's it. I hope everybody has a great day and a good work week. Thank you.